Assalamu alaikum dear students, welcome to your channel the anatomy canvas, and in today's class I am going to discuss with you the model of the cerebellum. So this cerebellum has three parts. In the center you can see the wormus is present, which is worm like area. On the each side you can see the two cerebral hemispheres are present. This wormus connects these two cerebral hemispheres with each other. Then there are the different fissures and present, which divides the cerebellum into different parts. So first of all you can appreciate this large fissure which is present over here. This is called the horizontal fissure, and when we trace it anteriorly you can see on the anterior aspect also here this fissure is traced over here like this, and this is the posterolateral fissure. So one which is present over here, this is the posterolateral fissure, and then other over here you can see this one is the anterior fissure. So this horizontal fissure divides the surface into superior and then the inferior surface. So this surface of the cerebral hemisphere is the superior surface, and this surface of the cerebral hemisphere is the inferior surface. Then this fissure which is present over here is the posterolateral fissure, which separates the posterior surface from the flocculonodular lobe. Sorry, this one is the here you can see this is the posterior fissure, horizontal fissure, which is traced over here. This is a posterolateral fissure which separates the posterior surface from the flocculonodular lobe. Then another fissure which you can appreciate over here, which is present over here in this area, this is the fissure prima or the primary fissure. So this primary fissure then separates the anterior lobe from the posterior lobe. So all of the structure which is present over here is the anterior lobe, and the one which is present behind the primary fissure, this is the posterior lobe. So now you can see the three fissures which are present. This one is the horizontal fissure which is present. Here you can see the posterolateral in this area you can see the posterolateral fissure which is present over here, and in this area you can see the primary fissure. And three lobes: the anterior lobe which is anterior to the primary fissure, the posterior lobe which is posterior to the primary fissure, and then the flocculonodular lobe. This one is the flocculus and this part is the nodule. Now I will show you the other different structures, other parts. So anterior lobe is further divided into three parts. This part is the of the anterior is called the central. This part is called the central, this is called the culmen, and this area over here is called the lingula. So anterior lobe further divided into three parts. In the center you can see this is the lingula, then you can see the central part, and then you can see the culmen. Then the posterior part which is present over here. So now on the posterior aspect you can see over here this was the primary fissure, and area behind this primary fissure, all of it is the posterior lobule. Here you can see another fissure which is present. This is the posterior fissure which divides the posterior lobe into different parts. So the part of the posterior lobe which is anterior to this superior fissure over here, you can see this is called the simple. Then part which is behind the superior fissure is called the folium. Then moving on to the inferior surface, here you can see the tuber is present. This part is called the tuber. Then you can see another sulcus which is present over here. You can appreciate this sulcus in this slide here. You can appreciate this in this area. This is called the prepyramidal surface sulcus present on inferior surface, which separates the pyramid from the tuber. So this area is the tuber, this area is the pyramid, and then is the uvula which is present over here. This area is called the tonsils. So again I repeat, on the posterior aspect you can see this one was the primary fissure, the posterolateral fissure, and in between these two fissures you can see simple. Then behind the posterolateral fissure you can see the folium, then the tuber, then after the prepyramidal sulcus you can see the pyramid, then the uvula. So these are the different parts of the posterior lobule. On the anterior surface you can see over here that, as I have told you, that this is the lingula. In the center, the part of the vermis which is present, this is the lingula, and then the central. Here you can see the nodule which is present, and it continues as the flocculus. So this is the third lobe, which is the flocculo-nodular lobe, which is present over here, and then the lingula. Sorry, uvula. This part is called the uvula. So here you can see the uvula. On the anterior aspect, you can see the lingula, the nodule, and then the uvula. This one is the cerebral hemisphere. This one is the, here you can see this area, this is the flocculus, and here is the nodule. So this one is the anterior surface and different parts. This one the superior surface, this one is the inferior surface, and this one was the primary fissure, the horizontal fissure, and then the over here you can see the posterolateral fissure. Three main fissures. Some books describe 3 fissures and other described 5 fissures. So when we describe the 5 fissure, we can see this one is the primary fissure, the posterosuperior fissure, then the horizontal fissure. Here you can see in this area, this is the prepyramidal fissure, and then you can appreciate over here in this area, this is the posterolateral fissure. 3 lobes, the anterior lobe, the posterior lobe. The posterior lobe is larger, and then you can see the flocculo-nodular lobe. Out of these lobes, and then again different parts of the lobe. The primary lobe divided into lingula, the central, and then the culmen. So this area is the culmen, this area is the central, and here is the lingula. Then the posterior lobe, this one is the simple, then the folium. Then on inferior surface you can see tuber, then you can see pyramid, and here you can see the uvula. So these are the different parts of the cerebral hemisphere. When we see the inner aspect, you can see different patterns which are present. So these are the different foliums, and here you can see arbor vitae which are present over here. This one was the cerebral peduncle, which connects the cerebellar peduncle, which connects the cerebellum to the midbrain. So this is all about today's model. Here is another model of the cerebrum. Here you can see again the superior surface, and then the inferior surface, and then the here you can see this, just a minute. Here you can see the primary fissure, the posterosuperior fissure, then you can see the horizontal fissure. On inferior aspect, here the present is the prepyramidal fissure, and on this area you can appreciate the posterolateral fissure. So these are the 5 fissures. This one is the flocculus, this one is the nodule. On anterior aspect, you can see that, just a minute, this one was the anterior lobe and the posterior lobe. So anterior lobe divided into lingula, the central, and the culmen, and on anterior aspect you can see the lingula, then you can see the nodule, and here you can see the uvula. So these are the different structure of the vermis which you can see anteriorly. This one is the flocculus, and this one is the superior surface, and on superior surface the anterior lobe, the posterior lobe, between two is the primary fissure. This fissure is present on the posterior surface. This is posterosuperior, which divides the surface into simple lobe, and then the folium, then the tuber, pyramid, and uvula. So this is all about for the today's lecture.